Hello, viewers, and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified rheumatologist and an obesity medicine specialist. Today, I would like to share with you a learning case of a lupus patient who has been following me for his lupus care for a while. And today, the encounter led me to think about a learning point that I would like to share with you. And again, if you are a new listener to YouTube and you have found my channel, Youthful Medicine, I hope that you find it useful. On this channel, I talk about autoimmunity, inflammation, obesity, integrative medicine. I am board certified in 4 medical specialties, and my passion is to help improve public knowledge and education so that everyone can improve their life based on low cost education regarding health topics. This is a channel which is separate from my medical practice as well as my telemedicine practices. This is purely my effort to share my passion for treating autoimmunity, inflammation for benefit of public. If you like this channel, please subscribe it and support it by liking the video and also share it with somebody who might find it useful. So today I'm discussing with you a case of 55 years old male who has systemic lupus and reports experiencing flares every 3 to 4 weeks, characterized by fever, chills, joint pains, and occasional vomiting and abdominal discomfort. He's currently on Plaquenil, hydroxychloroquine, 400 milligrams daily, and at his recent visit, I'd given him a short course of prednisone, which he likes to avoid because of his obviously potential side effects. So, what is going on here? So, a patient of systemic lupus usually present to follow up with rheumatologist, and when they meet us, they talk about their disease activity. So, we try to take over the course of their illness in a longitudinal way and find out what's happened since the last visit. So, there are some features of lupus disease activity that can manifest as either skin rashes, joint pains, sores in mouth or nose, hair loss, photosensitivity, new rashes, fatigue, morning stiffness. And sometimes you can also see symptoms of GI, gastrointestinal symptoms. Obviously, there are certain diseases that can be happening but are silent, such as kidney disease. So that for that reason, urine analysis and blood tests are important. But with this patient was telling me that he's having joint pains. Now, with hydroxychloroquine, we tend to see that patients have significant amount of improvement in their fatigue and their skin rashes. Hair loss becomes much less. Their sores in mouth or nose become less frequent, but they can have persistent joint pains because hydroxychloroquine is not the strongest medicine when it comes to controlling joint pains. Then the question arises, what is the right way to do it? Well, the easy way would be to keep giving patients prednisone, but really it's not useful. Long term, it's a medication like sugar. It makes you feel good right now, but in long term, you'll develop diabetes and so many other complications. So I like to avoid prednisone as much as possible. In this case, during my examination and found out that the patient has some tenderness in his joints. Fortunately, no other significant problems were noticed on the exam. So to address this flare, we decided that we could consider medication for him, an additional low dose azathioprine, also brand name called Imuran, Imuran. Imuran, azathioprine. So before you start anyone on azathioprine, your doctor, your rheumatologist would check a test called TPMT test. This is a genetic test to make sure that your body is able to metabolize this drug without any problems. So TPMT testing was already done, phenotype and genotype, and this patient is an intermediate metabolizer, meaning he can tolerate the low dose to medium dose, but he cannot tolerate high doses. Azathioprine dose is usually 150 to 200 high dose, 50 to 100 medium and low dose. So I would suggest that we use this medication to decrease the immune activity by decreasing the frequency and the severity of lupus attacks and improve his joint pains. This medicine is pretty safe, but we still monitor labs for toxicity such as white blood cell count and liver comprehensive metabolic panel. So what I told him is to start with 50 milligrams daily, but continue hydroxychloroquine. My patient was asking if he should stop the hydroxychloroquine. Well, the benefit of hydroxychloroquine are there already. We can see that because when he started seeing me, he had skin disease as well, hair loss, and also sores in mouth or nose, which he doesn't have anymore. So we will be continuing hydroxychloroquine. I like this medication. It's very safe. The only thing is you need to make sure that hydroxychloroquine is also monitored for its visual side effects. So in this case, my patient goes to a regular eye exam every 6 months. Some patients go once a year based on their other medical problems. So my patient has been approved, cleared by ophthalmology that he can continue hydroxychloroquine, which I will continue for him. I will add azathioprine low dose, 50 milligrams, and if needed, I can go up to 100 milligrams. I did talk to him about some occasional joint pain relief. He has some osteoarthritis, some back pain, for which he's using a medicine called Celebrex, which is an anti-inflammatory. Again, anti-inflammatory are even available over the counter, but these medications are you need to monitor for kidney and liver disease, so don't overtake them, and also discuss it with your physician about the medications you take over the counter and make sure that they are safe for you. So the modulating effects of hydroxychloroquine and azathioprine combined together are most likely going to help this patient to improve symptoms. I told him that I will see him in about 12 weeks for follow-up visit, and until then, if he runs into any problem, he'll reach out to my office so that we can do it. Again, this is the summary of a regular encounter of a lupus patient with a rheumatologist who is having mild to moderate symptoms and how a rheumatologist would address this problem. Again, this is purely my approach. This is something that is not advice for you to treat your lupus. You should consider consultation with your rheumatologist, but this is one of the ways that you can understand that how does a trained rheumatologist think about adding medications or monitor your disease activity, so that when you go there and talk to them, they have a sense of a better communication, and you have a sense of what they're uh, why are they suggesting something for you. In any case, if you like this video, thank you for watching this. Please give it a like, subscribe it, and I will continue to produce some useful information for you. Take care of yourself, and I'll see you in the next video.